Hi, everyone. I am Dr. Cynthia Hall. I am a naturopathic doctor and certified acupuncturist. And today I'm going to be chatting with you about how to thrive through your 40s and your 50s and how specifically you can start to use bioidentical hormone replacement therapy if it's right for you to help you get through your day and help you feel like you're rocking through it. So I'm going to pull up the slides and we're going to get started. Now, for many of you, what the heck is bioidentical hormones is one of your first questions. The second thing that I normally see is that 95% of the women that walk through my door are usually not saying, "Hey, Dr. Hall, I'm here because I want to be prescribed bioidentical hormones." Most of the time, they're saying, "Hey, Dr. Hall, I feel like crap. I don't feel good. I'm exhausted all the time, but I can't sleep through the night. I'm not only experiencing hot flashes, but I am irritated. I cannot stand my husband. I love him, but I want to murder him. I'm yelling at my kids all the time. I feel awful. They feel awful. Everything just feels completely out of control." So I'm not going to spend too much time on me because really this is about you, but my passion is women's health and my focus is usually from puberty all the way through the golden years. And my big focus is on fertility and pregnancy, as well as after all of those reproductive years are over, how do you transition into menopause and really feel like you are still thriving and that the world hasn't forgotten about you just because you had a baby. So, I want you to take a look at these questions. And really, I want you to really reflect over the last couple of months. Have you ever missed out on a fun event because of something that was distressing that you just didn't feel like you could go? And now, whether or not this was you're bloated and you're not feeling like you're fitting into your clothes, you're invited to a Christmas party, but the dress that you wore last year doesn't fit, despite the fact that you're still only eating 1,200 calories in a day and you're doing hard HIIT workouts 5 times a week, nothing is changing. Or worse, did you go to this event and have a miserable time and just sit there and compare yourself to others and pick yourself apart and just feel like, well, pretty much feel awful and miserable in your own skin? And so much of this, I want you to know, is you are not alone in how you feel, and that so many women also feel this way. And a lot of what people are going through is invisible. Now, what that can result in is that feeling of the loss of control. Now, for those of you that were able to download my sadistic game of perimenopause bingo, I'm just going to pull it up here. This game is a way for you to start looking at some of the symptoms that you might be experiencing that indicate you are in perimenopause, but also aren't kind of that red flag of, hey, your estrogen and your progesterone are out of whack. Now, if we take a look at this list, let me know what resonates with you. Is it the fact that you're now consistently getting urinary tract infections out of nowhere? Is it the fact that now intercourse is now painful? So not only can you not stand your husband, but now when you can stand your husband and you want to have some intimate time, you can't because it's just awful and it's painful and it sucks. Okay, well, these are all things that are invisible. So that first one on the list, hot flashes, we know what that is. Okay, so I see it in my mother. I see it in my grandmother when they went through these transitions. It's 30 degrees outside. Yeah, everyone ripping off their clothes and they're sweating through everything and they feel miserable and gross. And I remember being a kid thinking, oh gosh, I hope I never get to that point, or I hope that never happens to me. If you take a look at this list, that's probably the only one where we usually see it. The rest of them are invisible. But I want you to know that you're not alone in a lot of what these symptoms are showing. Another big one that I see come up is, again, that waking, that stubborn waking where it's happening around your midriff and it's not coming off. And all of a sudden your blood sugar's out of whack. And all of a sudden you're getting acne like when you were a teenager. Again, and one of the big ones I actually really want to say is I've really find a lot of times women are coming into my office with a sense of overwhelming anxiety. So not only do they feel like their plate is completely full and overflowing, but when that's happening, they now no longer feel like they have the tools to be able to get through that. And they feel like they're completely drowning. And that is not what we want. I'm going to get back to the slides because guess what? You are in perimenopause. Now, I want you to imagine living your life where everything we just talked about on this on this bingo card from hell stops holding you back. All right, so what the heck is perimenopause? We talk so much about menopause and we see all of these commercials for all of these different prescriptions for menopause, but what exactly is perimenopause? All right, let's start at the end. Menopause. A mentor of mine put it beautifully: when the ovaries go for the big sleep. Perimenopause is that transition to when they start to go to sleep. And one of the big things with perimenopause is that we have our estrogen, progesterone, and our testosterone, so our reproductive hormones that in women are primarily produced by the ovaries. Guess what? They're also produced by some other places in the body. And so when the ovaries go for the big sleep, we now rely on those other places, such as the adrenal glands. Over the last probably 5 to 10 years, adrenal fatigue has become sort of a hot topic. Now, whether or not you believe in adrenal fatigue or not, we know that your adrenal glands will produce the estrogens, progesterones, and testosterones that you need, especially when you move into menopause. So making sure that your adrenal glands have a really strong foundation and are really well supported is an extremely important part of your treatment plan. Now, perimenopause, your cycles are starting to change. You're not ovulating as often. Because you're not ovulating, progesterone is starting to change. So we talked a lot about some of these symptoms like anxiety, insomnia. All of that is related to progesterone. Even if I find a lot of women actually come into my office saying, out of nowhere, I am bleeding through 2 super tampons and an overnight pad in an hour. What the heck? So not only am I exhausted because I'm losing so much blood, but also I can't do anything. I can't go to the beach. I can't wear the cute outfit that I want to wear because I am nervous that I'm literally going to bleed completely through it. Now, and I don't use those terms lightly, and I don't use them to disgust you, but I do want you to really understand that you are not alone in how you're experiencing a lot of this information. Now, how I like to describe to my patients is my very awful rendition of an iceberg. We talk a lot about the tip of the iceberg, so your reproductive hormones. We're talking about your estrogens, progesterones, and testosterones. But as you can see from this slide, no system acts alone. So here's your really bad triangular iceberg. And as we start peeling back the layers and we start looking at these foundational systems like your thyroid, your blood sugar, your stress control, all of this plays in to your reproductive hormones. And it becomes a little bit like a chicken and the egg situation. So is it because your reproductive hormones are dropping that we're starting to see these other results? Or is it because there's some things going on with these other areas that we're starting to see a big drop in these reproductive hormones? It's hard to tell. And honestly, the goal is not to blame any specific symptom or system, but the goal is to be able to support your reproductive hormones while we're getting to the bottom of what's going on in these other systems. Now, I keep saying you're not alone, and now I really want to show you the data that says you're not alone. So we talk about these hot flashes. Realistically, we say 85%. I'll be honest with you, it's probably more. But if you can take a look at these numbers, at least 1 in 4 women in your life, in your sphere of influence and in your circle of trust, your family, your friends, if you just take a look at this, at least 1 in 4 is experiencing one of these invisible symptoms. So as much as we don't scream from the mountaintops about our vaginal dryness, and we're not screaming from the mountaintops about how we have overwhelming anxiety, it exists. And I want you to know that because, again, there's a lot of things that we can do, whether or not it's hormonal based or otherwise. And I'll get a little bit into that too as we continue. So the reason why you came to this webinar is to learn what the heck is bioidentical hormone replacement therapy. So what the heck are these hormones and how are they going to help me get my life back? So I'm imagining my life where I'm not being held back, but how do I actually get there? What is bioidentical hormone therapy then? So as you can see from this slide, there's a lot of different options. So we have oral, so we have pills, we have creams, we have gels, we have patches, we have injections. There's a ton of different options. And I'll be honest with you, there's probably too many options for us to really get into the nitty-gritty details right now. But I mentioned that there are so many options because There's an ability for you to change what you're doing, find which method works best for you, as well as because there's so many options, we can tweak dosages, we can tweak how often you're getting these hormones. All of this stuff is really individualized, which is really exciting. Now, I want to tell you a story rather than going through each component of this slide line by line. Now, let's call her Jessica, but she's a great patient of mine and she's in her mid 40s. And she originally walked through my door and it had nothing to do with hormones. It was, I have Raynaud's, so my fingers get really numb and tingly in the winter. It's getting worse. I think I have arthritis. I have hypothyroidism, I'm pretty sure, because I can't seem to lose weight. My husband, he eats whatever the heck he wants and he runs 3 times a week and he looks amazing. I'm only eating 1,200 calories a day and I still can't lose this weight. I'm exhausted all the time. I'm yelling at my kids because I'm exhausted all the time, but I can't fall asleep at night. I lay down in bed and I feel like my mind is racing and or I do fall asleep and then I wake up at about 2 o'clock in the morning and I feel like the sheets are completely drenched. I'm completely drenched and I can't get back to sleep. Now, if any of these symptoms resonate with you, a lot of them are on that perimenopause bingo card. But the reason why I want to bring up Jessica is that we started with a lot of different things. Now, when we're talking about that iceberg, we're talking about those underlying foundational systems, we talked a lot through that. But also, I started her on some progesterone. Because she was still cycling, we took a look at starting her on progesterone in just the second half of her cycle. Now, the really great thing that you can actually use this bingo card for is almost as a symptom tracker. So at 8 weeks after I started her on this progesterone, I followed up with her and I said, okay, what got better? What got worse? What stayed the same? What showed up that was new? And now that you're spending more time focusing on what you're going through, what might you have not told me before that you thought actually is important now that we're getting into the nitty-gritty details? So Jessica and I talked through a lot of things, and over time, we started to realize, hey, you know what? She's starting to get some of her libido back. But that being said, being intimate with her husband and intercourse was actually quite painful. So then that tells me, you know what? It looks like we're in need of some estrogen. Now, one of the great things with estrogen is there's a ton of different ways to actually deliver it. So in Jessica's case, we did a really low dose, really safe version of estrogen, a form of estrogen just topically in the area. And that was able to get her to where she needed to be. Now, while all of that was going on and all of that support was going on hormonally, we also worked on a lot of different things. So again, she brought up that she thought she might be hypothyroid. All right, so we need to take a look at the thyroid and we need to take a look at, okay, what's actually going on? Why is your thyroid not functioning the way that we want it to be functioning? Why is it not functioning optimally? Now, again, I bring up Jessica because I want to really highlight that this is such an individualized treatment plan, but also this is not a set it and forget it. This is not, hey, here's a prescription, go get it filled, I'll see you in 6 months. This is, hey, we're a team, we're a partnership. I'm the Gandalf to your Frodo. This is your journey, and I'm here to guide you and give you all of the information and resources that I possibly can. But also, I want to make sure that you are as empowered and informed as you can be in order to make the best decision that works for you. And that might not be the best decision that works for any of my other patients, and that's totally okay. So I'm just going to jump back to the slides, and we're going to keep going. So overall, what are the benefits of hormone replacement therapy? It's individualized. If Jessica's story can help you in any way, it just says, look, there's a lot of different factors to our health. There's mental, emotional, spiritual, physical. All of that plays a factor in how we feel on a day-to-day basis. Not only that, we have our iceberg, and we need to get through each layer, and we need to build up that foundation. Because guess what? The goal might not be for you to be on hormones for the rest of your life. Now, in order to do that, we really need to build up and support those systems that are going to be making those hormones. Now, with respect to hormone therapy, the reason why I wanted to say that there's a good safety profile is that there's a lot of different types of hormones. And it's really, really important for you to talk to your healthcare provider about what hormone type they're putting you on. And the reason why I say that is that in the early 2000s, the big ticket item was conjugated equine estrogen. And this was a type of estrogen that was derived from the urine of horse mares, so from female horses. And what scientists and researchers found was that over time, the use of this type of estrogen actually increased a lot of really bad, scary risks. Now, mostly, I would like to hope that most healthcare professionals have read all of that research and are not prescribing any of that, but it is important, and I want you to feel empowered to be able to advocate for your own health and be able to ask that question that, hey, where is the estrogen that you're prescribing me? Where is it derived from? I want to make sure that I know what's going on in my own body. Now, same with progesterone. There's synthetic. So the best example of a synthetic progesterone would be an IUD. The best example of a synthetic progesterone or estrogen would be your hormonal birth control pill. So there's synthetic progesterone, and there's what's called oral or micronized progesterone, so your bioidentical progesterone. Two completely different progesterones. Research shows one is better than the other. One, your micronized progesterone can actually be used in some cases of fertility, and I have used it. So even though they're not past the fertile years, and they're not past the feeling that they want to have children, they can still use some progesterone if it's needed. But again, my goal is for you to feel as empowered as possible so that you really are going into your appointments and you know what it is that you're putting either on your body or in your body. And the whole point of this is to take back control of your life. So one of the first things that I have noted here, and that we haven't talked about, but is bone health support. It is very well researched that the decline in estrogen increases the risk of osteoporosis. So if you have a family history of osteoporosis, or if you are at greater risk of osteoporosis, perhaps from long-term steroid use like prednisone, this is a really important conversation to have with your doctor. This is a really important conversation to have because we can get ahead of that increased risk of osteoporosis and of falls and of breaks and hospitalizations because of broken bones. So I'm not going to read the entire list, but again, the entire point is for you to feel empowered in your own skin and for you to feel truly like you have taken control of your body and that you can handle what life is throwing at you. So I've thrown a lot of information your way. Now, most likely the biggest question that you have is, am I a good candidate for hormone therapy? And the short answer is probably, but we don't know, and I want to make sure we're having that conversation. The reason why I say that is that there are some cancers, such as endometrial cancer or breast cancer, where for the longest time we found, you know what, if you've had that or if you have a family history of any of those types of cancers, hormone therapy is not right for you. Now, within the last probably 5 to 10 years, newer research is coming out that is saying, hey, you know what? Because we can use different forms, some of these different forms are actually shown to be safe in these types of populations. So again, my goal is for you to be empowered and truly feel like you are informed when you're making these decisions. One of the things that I love to do with my patients is actually go through a breast cancer risk assessment calculator. And if possible, I do it actually in the appointment. If not, I'll do it after and send them the link so that they get all of the information. And the reason why I do that is I like to say, okay, this is your breast cancer risk. Now, whether or not that's because you had breast cancer, or whether or not that's because your family has breast cancer, or you have those genes, the BRCA1 or BRCA2 gene, that indicate that you have a greater risk of having breast cancer, or maybe you've had other cancers, number one. Or number two, with hormones, this is your increased risk of breast cancer. Now, some people might be okay with that increased risk, and some people might not be. But again, it's not my decision, it's your decision. And the whole point of having this really open and honest conversation is so that you can make the right decision for you. Because at the end of the day, I can give you as much information as possible, but if you don't feel comfortable because you're worried that it's going to increase a risk of anything, then we need to talk through that And it's my responsibility to then provide you with other options. And one of the beautiful things about naturopathic medicine is that we have access to hormone therapy, but we also have a huge toolbox of all of these different things that are not hormonal based, that are also really, really effective with helping to reduce hot flashes, with helping to improve a lot of those symptoms that are on that bingo card. So I want you to know that just because you take a look at this list and just because you're taking a look at your family history and you're thinking, damn, this doesn't apply to me and I'm screwed. I want you to know, no, you're not screwed. And number two is let's have that conversation and let's really build upon the information that you have and then all the information in my own toolbox that I have. So what you can expect from working with me. Now, we are going to need to do some comprehensive lab work. If you're still cycling, so this means if you still have a menstrual cycle, there's information at the beginning of the cycle that's really important and information in the second half of the cycle that's really important. All of that information all plays into what's going on with your hormones. Are they still doing this through your cycle? Or are they doing this? Or are they doing this? Or they're just completely, I mean, you can't even see them on the screen anymore because they've completely bottomed out. All of that is really important. And that helps create a really strong baseline that we can then look back on and say, okay, what has improved? What hasn't improved? And you can take a look at this list here. But a big part of it is I really want to be able to have that open discussion with my patients. And I want to be able to say, look, we can try this. And if this isn't working for you, that's okay. I'm not going to take it personally. I'm not the one that has to go home to my husband and my children and feel absolutely miserable being around them. That's if I can get you even to 60% better than that on a regular basis, then that's a huge goal. And that's a huge benefit. So again, this is not something that we set and forget. I usually like to do follow-up appointments every about 6 to 8 weeks. And then once we've got you on a good regime and a good schedule and things are working for you and you feel, you know what, I've reached the peak. I think this is where I want to be. That's when we can start to lengthen that time. The good news is that you don't have to wait 8 weeks to start seeing results. Patients typically see results within the first 2 to 4 weeks. So again, going back to this bingo card, it is a great way of tracking, hey, did this get 20% better? Did I go from 8 hot flashes a day to 2 hot flashes a day? So I may still be having hot flashes. Okay, we need to work on that. But if I'm now not experiencing those 6 extra hot flashes in a day, that's a huge win. And that's something that is awesome. And we don't want to downgrade that or downplay that just because it hasn't completely disappeared. Now, I know I've shared a ton of information, and this is something I'm extremely passionate about. And really where I'd like you to leave this webinar, what I would like you to leave this webinar with is the decision and the empowerment to really feel like you can take back control of your own life and that you can truly feel like you aren't being held back from doing the things that you love with the people that you love when you want to, just because of some of these invisible symptoms of perimenopause. And I also have a really big goal in mind that I want you to live the longest, healthiest life that you can. And that transition into menopause doesn't have to be miserable. You don't have to be looking at my sadistic game of perimenopause bingo and thinking, darn, I'm checking all the boxes and feeling like you're completely left drowning. That's not the goal. The goal is that you are rocking and rolling through your life. The goal is that you are wearing many, many hats. So you're wearing probably chef, chauffeur, businesswoman, mom, late night homework helper. You're able to do all of this, and you're able to do all of this with a smile on your face because you truly feel like it's not overwhelming you, and you truly feel like you are finding the joy that's in your life. So thank you very much for listening to this webinar. You will be able to find me online through the Greenhouse website, as well as my own personal website, maplefertility.com. But again, I like to provide as much information as possible to all of my patients. So take a look. If you have more questions, feel free to book online and we can chat a little bit more. Thank you.